So when I was growing up, there were 4 or 5 women in my family who had diabetes. And one of the things that was constantly said to me is that we would never use insulin. They were terrified of insulin. They kept panicking at the idea of it. They were scared that they would overdose themselves or underdose themselves. So most of the women I know never took insulin for diabetes. And a couple of months ago, in fact, one of my cousins developed diabetes and she started taking insulin. She goes to her mother and she shows her the new insulin pen. And this lady is fascinated and she's looking at this technology and saying, oh my God. I mean, it's so easy to administer. There's a new kind of pen which even calculates for you how much of insulin you need to take. The technology when it comes to treatment today has advanced so much for so many diseases. And personally, I don't know about you, but I find a lot of comfort in it. I know that diseases are evolving. I know there's a new disease coming every so often. There are things to be afraid of. But on the other hand, if you get to know a little bit about how much healthcare is evolving, that gives me a lot of solace, gives me a lot of motivation that there is hope for us. This is Sonali Acharji, and you are listening to Health Wealth, a podcast that hopes to make health exciting, accessible, and most importantly, understandable for all. This podcast series also seems to have come full circle. Our pilot was actually recorded with Dr. Randeep Guleria, who is the chairman of the Institute of Internal Medicine, Respiratory and Sleep Medicine at Medanta in Gurgaon. And it was done on predictive healthcare. And today I have him again with me. But this time we're not going to talk about the future outcomes of your health, but to talk a bit about the future outcomes of healthcare. Dr. Guleria has been at a part of this industry for so long, and not just in his capacity as a director of hospitals and various committees, but also as a pulmonologist and researcher. So, with the new year starting, I can't think of a better conversation or a better person to have this conversation about on the upcoming health trends for this year. Hello, Dr. Guleria.
Thank you for having me on the show.
Thank you. So one of the things that, in the last 20, since the pandemic, actually, healthcare just seems to be evolving so fast. There's always a new medicine, there's a new vaccine, there's a new disease, there's so much happening. Is this promising for you? Does this make you feel that modern medicine is keeping at pace with modern diseases?
Definitely. If you look at healthcare, I think what we're seeing right now, and we talk of the fourth industrial revolution, we're seeing technology come into healthcare in a very big way. And it's come into healthcare in terms of technology and devices, and in terms of pharmaceuticals and vaccine, newer drugs. This is where the future is going to be. So when we start looking at technology, COVID showed us that we could reach out to patients and provide care using telemedicine. You could monitor patients using asking them to monitor their oxygen saturation. And we have so many devices. You have your Fitbit devices, your watch, which can tell you your ECG, your heart rate, your saturation. So technology has made us more aware of our health than ever before. Also, at the same time, because of a lot of research, we're coming up with new ways to treat diseases, whether it be preventive health, whether it be, like you mentioned, better insulins, long acting insulins with insulin pens, or newer vaccines, or drugs for cancer. Many cancers, which were fatal a few years ago, are now being considered like chronic diseases. You need to take your medicines regularly, and the cancer is under control, and it doesn't affect your longevity. So I think it's an exciting time for medicine. The challenge is that we need to really have our doctors and healthcare professionals trained to adapt and evolve to really take on these new technologies, these new things that are coming in, and provide better care to our patients in I feel, a cost effective and a sort of ethical manner with a lot of empathy.
Yeah. I mean, we started off talking right about technology, and one piece of technology which everyone's really excited and a bit afraid of is artificial intelligence. Um, How is this going to impact healthcare? Because it's already making its way, and a lot of hospitals are training their manpower in AI. Do you see it taking off even further in 2024?
Yes, I think you will not be able to stop artificial intelligence. It will complement healthcare and in a good way. So artificial intelligence, machine learning are all going to be there.
Hmm.
So let me give you a few examples where they would be very useful. We have a huge load of, let's say, radiology, CT scans, MRI being done. AI can really help you in really picking up abnormalities faster and in a more accurate manner than the radiologist will be able to do. That is true also for skin lesions. If you have a skin lesion, you could take a picture, send it onto an AI platform. It could help you interpret that skin lesion and even give you a diagnosis. Same is true for pathology. If you have a slide, AI could help you pick up abnormal cells in a more accurate manner than the human eye. So it will complement what you are doing and help you also in terms of your data analysis and being more predictive in terms of how health of an individual is evolving over a period of time. So I think AI is here to stay. One is very worried because there's this whole issue of AI replacing physicians, AI
Yeah.
replacing healthcare workers. That probably will not happen because what is very important in health is also what I call the art of medicine, the empathy that you have with your patients, the connect that you have with your patients, understanding what a patient is saying, which he's not verbalizing. Those things are something which a physician needs to really do, which as of now AI is not able to provide. So AI will complement healthcare and it's going to do it in a good manner. And I think it's here to stay and it's going to be the future in terms of providing better quality health to our patients.
Yeah. No, I remember a couple of about 5, 6 years ago, my mother was on the ventilator, and she's had the same cardiologist for about 10, 12 years. He just had to walk into the room and she was already looking better. So there was that bond between a doctor and a patient, that also makes so much of a difference when it comes to treatment. Um, Alongside that, there's also so much happening with AI and predictive healthcare. I mean, I did talk to you about this before, but is there anything else happening with diagnosis that's interesting and that people should be aware of?
So in terms of diagnosis, AI is helping in terms of developing better algorithms for early diagnosis of various disorders. And as we move into two broad areas, you see, where are we evolving? We're evolving to two areas. One is a huge burden of non-communicable diseases.
Hmm.
These are lifestyle-related diseases, and AI could help pick up diseases earlier than what one would otherwise have based on a number of factors which could be combined into an AI algorithm.
Hmm.
Also, you could look at AI and see whether you can look at some genetic predispositions, which may be picked up to say that you are more predisposed to this type of non communicable disease, whether it be hypertension, diabetes,
Hmm.
heart attack at a later age, or chronic kidney disease, things like that. So I
Hmm.
think that is something that AI will be able to do very well. And like you said, predictive and preventive health.
Hmm.
By looking at your wearable devices, looking at the data, analyzing it, using an AI based software, you could actually predict an event before it happens and be
Hmm.
able to intervene in a manner which the patient is told that you're going to have an arrhythmia, you probably your oxygen saturation is falling, you may need hospitalization. It could alert the hospital or the emergency services nearby that such a patient is going to come, he needs this type of care. So a coordinated effort in terms of providing timely care in and predicting events is something also which AI could be useful in.
Yeah. And but once this is predicted, I think a lot of people are really scared to find out what might happen. I myself have done one series of genetic testings. I have a marker for diabetes. Now, for me personally, that makes me feel really happy that, I know this is going to happen. So I need to, cut down on my sugars, maintain my weight, make the changes now so that it won't happen in the future. So, is that something you think we should be talking more about? That by knowing what will happen, we can prevent it. It's not something to make you afraid of the future, but more to guarantee a healthier future for you.
Correct. The only challenge is that we must have tests which have a high predictive value. For
Mm.
example, we know that, if you have, let's say, the BRCA gene, and you can say that you have a high chance of breast cancer, you can take preventive measures. We have the whole story of Angela Jolie going ahead and having surgery done. On the other hand, you may have a whole array of tests which may come up to be positive, and you don't know what is the positive predictive value, how accurate are they that you will develop a particular disease in the near future. So this is an evolving science, and there are certain markers which have a high predictive value, which will be very useful. There are others which are evolving over a period of time. So we need to understand that this is a science which is evolving. This is the future. But yes, those tests which have a high predictive value, which are in which intervention is available, those are something that we should really move forward in, because then you can prevent or at least delay a large number of diseases for which you have markers, or you can move in what is known as personalized medicine from that point of view.
Yeah. Another thing for prevention has been vaccines, and 2023, a lot of adult vaccines came into the market for shingles, cervical cancer. This is not something, which a lot of adults in India seem to be very keen about, to take vaccines at a later age. Do you think this should change, and it will change in the coming year?
I personally feel this should change. I'm a big proponent of adult vaccination. I've been doing that, and I had hoped that post COVID there would be a big acceptance. It hasn't happened that much.
Mm.
But if you start looking at vaccine preventable diseases, and there are a large number of diseases in the adults, high risk group in the elderly, which can be prevented, or their seriousness can become less if vaccine is taken. But somehow that uptake is not as strong as it is in, let's say, the pediatric age group. Parents are very keen on getting the child immunized completely, but they would not be that keen on seeing that their parents or the child's
Yeah.
grandparent is properly vaccinated
Yeah.
from getting a pneumonia or a flu, which could also be life threatening because of decreased immunity as one grows older. So I think we need to aggressively push for adult immunization, life course immunization, where you look at immunization during your entire lifetime, cervical cancer at an early age, immunization for that,
Mm.
for pneumonias and other infections later on, for shingles or herpes zoster after the age of 50. So, a life course vaccination is something that we are not doing, and we need to push for that. I think that is something which will also evolve, but there needs to be more and more push for adult vaccination.
Yeah. I think it's also the availability of these vaccines. It's not like COVID was done in a way you went to a COVID center and you did it. I've recently given the pneumonia vaccine to somebody, and it's a little bit more complicated. You have to get the vaccine at a pharmacy, get somebody. So I think that also perhaps deters people to some amount, the convenience of it.
Correct. I think two factors. One is the convenience and the schedule, and the fact that you have a much larger adult population as compared to the pediatric population.
Hmm.
And also the fact that there is some vaccines are costly also. So the COVID vaccine
Yeah.
was free. So a cost factor also comes into play when you're looking at some of these vaccines, because they're not that cheap. So I think all of that needs to sort of be built in. And I hope in the future we will have adult vaccination centers where you could go, you have your vaccination chart as you have in the pediatric age group, and you go there and you get your vaccine. You have a reminder on your phone that your vaccine is due, and it's available, and it becomes cost effective.
Yeah. So in the coming couple of years, we have our deadline for eliminating tuberculosis coming up. And, there's been a lot of work being done there. Other than TB, are there other priority diseases that we really need to focus on bringing the numbers down on?
So tuberculosis is one disease that we need to focus on. So if you look at diseases, we're looking at two broad sort of
Mm.
areas. One is infectious diseases, tuberculosis being one of the
Mm.
biggest ones, and the other is the non-communicable disease that we talked of some time back. So among the infectious diseases, we would like to eliminate tuberculosis. We would like to eliminate a lot of vector-borne diseases, malaria, dengue. Those are the things that we would like to see also eliminated, because there are vaccines which are evolving and are available for these. There is also a lot of studies being done for a new TB vaccine. Hopefully, that should also come in because we don't have effective TB vaccine.
Yeah.
But TB is, the bacteria is more difficult to eliminate. The treatment is long. It hides in the body. We have what is known as latent tubercular infection. You may have the TB bacteria in your body, but you are asymptomatic, and you may remain asymptomatic throughout your life with the bacteria in your body, and not getting the infection, or getting the illness. So I think it's a challenge that we have to accept, that we need to really work on eliminating tuberculosis. It's something that is doable, but it needs a lot of community participation. So infectious disease is one sort of bucket that we need to look at. The other thing that we need to look at is how do we decrease the burden of non-communicable diseases? Because here the burden is lifelong. If you have a person with heart disease, or hypertension, diabetes, it's a lifelong disease. It's not like TB that you take a 6 months course and then you're all right. So how do we develop a strategy of making sure that people continue their treatment? We monitor them for any what we call end organ damage, that they don't, because of poor control of sugars, the kidneys are not getting affected, the eyes are not getting affected, or because of blood pressure being not controlled, they don't get a stroke. So how do we develop a strategy for managing this huge burden that we're going to have of chronic non-communicable diseases, which will require close monitoring and good patient compliance? So the health strategy has to shift from what we were doing 20, 30 years ago, where the focus was predominantly on infections, diarrhea, childhood infant mortality, maternal mortality, TB, malaria. We have to now look at these new diseases which are evolving, which are lifestyle related diseases, where we need to look at preventive health, early diagnosis of these diseases, and then how do we manage them throughout an individual's life, so that he is able to control these illnesses and they don't lead to complications, as we see in many of our patients.
Yeah. So some of the prevention for non-communicable diseases also lies in the hands of the individual. And, every few years we talk about, some health tips or health guidance. Given where we are today and, the increase in unhealthy eating habits or, sedentary lifestyles, is there something you have learned that you would recommend to look after one's health, um, to make these choices? Because it also seems quite inescapable now. How do you escape from this world of Swiggy, Zomato, instant food coming all the time? It's just there everywhere you go. This is the food you're getting. I went to a hospital canteen once, and you look at the hospital canteen itself as those brownies and
Hmm.
patties. It's hard to get that kind of nutrition. Also, everything is convenient. You don't walk as much. If you walk, there's pollution. So, what can one do? It's almost like our modern lifestyles have us trapped in a way.
Correct. We have really evolved into a situation where we've actually made our life more comfortable but not very healthy. So I think we
Yeah.
need to really develop a strategy of how do we really balance things in life, whether it be a physical activity, whether it be the diet that you're taking, or whether it be the risk factors that you have and how do you prevent them. So if you have, let's say, a strong family history of diabetes, you know that you are more predisposed to having diabetes because of a family history. So you should start looking at your weight, the diet that you're taking in terms of carbohydrates, and the exercise that you do. Similarly, if you have a strong history of heart disease or hypertension, cut down on your salt intake, be regular in your physical activities, and develop a sort of a lifestyle related act plan which feeds into your day-to-day living. So something that people have found helpful is doing breathing exercises. Yoga helps. So giving some time for yoga, giving some time for your diet, trying to really focus more on what is healthy, greens, taking more of salad, things like that. But I do agree with you that it is becoming more challenging, because as as we sort of evolve and become more economically better, the let's say the pressures of society and convenience of society also are affecting health. That is true.
Yeah. And also find it very interesting that, when you, as Indians, well, not just Indians, I think it's in many cultures, when somebody comes home, feeding is a sign of love, of warmth, of hospitality, and we like to feed a lot. But a lot of what we are eating today was never designed for, the average couch potato or the average office worker, A lot of the biryanis or the lot of the, extremely high calorie foods were there for, laborers or farmers, people with a lot of work going on. And somehow, that sense has not happened. We're still eating the food or looking at nutrition as, one would have decades ago, and today's lifestyles have just changed. Does this also impact how we fare in terms of long-term immunity? Because this is also something, like right now, if I'm eating things which are not good for me, at best it'll affect my weight. I don't really think that, 20, 30 years down the line, God forbid, I get some respiratory illness or some sort of illness, that this food that I'm eating today is the reason that I might not be able to, make it back, in the future.
So, right, our lifestyle has changed, and what was in the past was a lot of physical activity. People would walk a lot, people did a lot of physical work. And that's why the food that we had at that point in time had a lot of high calories, and it was something which was very rich. The food has not changed, but the physical activity has come down dramatically, and that has sort of caused an imbalance. Although we're talking of obesity, and we are seeing a lot of obesity, especially in cities and bigger towns, but the issue that you raised is something that is also evolving over a period of time, and that is the diet that you take, it alters your gut microbiome. So if it changes your gut microbiome, there is now data which is emerging that this can also affect long-term diseases and may have an effect even on various non-communicable diseases. So the diet that one takes now alters your gut microbiome, which leads to different bacteria in your gut. And there are more bacteria in our body than we have cells in our body. And these bacteria can affect how our immunity behaves over a period of time. And that can have a negative effect in the long run. And this is something that we're just learning nowadays as far as research is concerned.
Yeah. I'm glad you talked a bit about gut bacteria because, another area that I really wanted to discuss with you was AMR or antibacterial resistance. That's, it's becoming a huge problem in hospital settings. Do you think India is on the right track to handling it? Do you think, because the numbers seem to be increasing? I think the last ICMR survey showed a rise in it. Do you think we're aware of this and that, hospitals are coping?
So antimicrobial resistance is a huge challenge, and I think we are actually going through an epidemic, if not pandemic, of AMR. It's a silent epidemic, and the reason for that in India is there are multiple reasons, multiple sectors are involved, but misuse of antibiotics or overuse of antibiotics is the main cause. And that happens among physicians. For viral infection, also antibiotics are given. It happens among patients. You can just go to your chemist and buy an antibiotic and take it, and you may not even complete the course. A person would actually take the neighbor's prescription and get the antibiotics for an illness which he feels is the same as his or her neighbor's. And at the same time, there is no control of antibiotic use, even in, let's say, hospital setting, in terms of an antibiotic stewardship, that you should be careful in the antibiotics that you're giving depending upon the severity of illness and the background of the illness, if it's community acquired or it's hospital acquired. So that is one area where there is no control. Then the other area where there is no control is use of antibiotics in agriculture and poultry, in animal husbandry, where a lot of antibiotics are used for in poultry, in animals, and in agriculture, which enter the food chain, and the bacteria that are there, they then develop resistance to these antibiotics, and then they enter. They are what we tend to eat, and that's why we see a lot of infections that even happen in the community, which one would expect would become all right with normal antibiotics, not becoming all right because the bacteria that you've got now has become more resistant to the commonly used antibiotics. And we're really running out of antibiotics. And I remember a few years ago, I think it was 2014 or so, the Director General of the WHO, she said that, we are coming to an era where we will have a post-antibiotic era. where for illnesses we will have no antibiotics available because
Yeah.
the resistance is going much faster than the newer antibiotics which are coming up. So I think this is a huge challenge, and there has to be awareness among the public, awareness among policymakers, awareness among physicians, awareness among other sectors where antibiotics are being used of the magnitude of the problem, and we need to really work on a concrete, sustainable solution. A lot of things have been done, but the ground reality is that implementation is not happening. And that is why I still feel that anti-AMR is continues to be on the rise. We need to be more aggressive in managing it.
Yeah, no, I personally, I also feel that the internet has a lot to blame as well, because everybody feels that they're a doctor now. I was at a get together recently and I had a flu, and somebody's like, "Oh, you can take this antibiotic. I've read it. I've gone on to Wikipedia. I know its side effects." And it's hard to explain to people that medicine and what doctors know is a lot more nuanced than just reading Wikipedia or what Google throws at you. It's easy, like for example, you take an organ, you can read as much as you want, but there's so much more that doctors learn. There's so many things to take into account before a medicine is given to you, and it's not possible to do that just by going onto the internet. So there is an issue with people self-medicating today, isn't there?
Definitely, this is a big issue, and unfortunately, it's an issue in the and the emerging markets. Not that much of an issue in the developed world, where you cannot get an antibiotic without a prescription. But in our country and this part of the world, this is a huge issue because not only do people advise you on what is on the net, it's easily available if you go to the counter. So you could say that you need an antibiotic, but consult your physician. But here you don't even need to consult your physician. So the exploitation of what is said by Dr. Google is huge. It not only in terms of antibiotic use, but also in terms of misinformation and people sort of treating their illnesses in a wrong manner, creating more complications without realizing that they are sometimes doing more harm than good.
Yeah. In fact, I think during the pandemic was when it really came out, how much of this was happening. And it was a problem in, keeping control over all the other medicines that people were taking. Sometimes steroids, which were making them more ill, because they were taking it at the wrong time. Um, if God, I mean, and there seems to be quite a lot of talk that there would be another pandemic like COVID-19. If that is to happen in the coming few years, do you think we're prepared for it today? Better prepared than what happened last time?
So in a way, we are better prepared, but we need to be, I think, our preparation needs to be much more. This century, the last 23 years, has been a century of outbreaks. If you look at the number of outbreaks that we've had in the last 23 years, we've had SARS outbreaks, we've had Ebola outbreak, we've had H1N1, two pandemics, H1N1 pandemic, the swine flu pandemic, and the COVID-19 pandemic. We have MERS outbreak, we've had the Zika outbreak, and in India, we've had a Nipah virus outbreak also in the south. So we are seeing a lot of outbreaks which are basically related to our encroachment on the environment and a lot of viruses jumping species and then having the capacity to become novel human viruses with sustained human to human spread. And of course, the issue that we are not traveling much more. So you can carry your virus or infection quickly from one part of the world to the other. And that's how the infection tends to spread. So we will see more outbreaks. We need to have very aggressive surveillance, not only at a global level, but at a national level, so that we pick out and we are able to see an outbreak early and take preventive measures, which we were not able to do last time. And it spread from China to Europe and then to the whole the world. We should be better prepared in seeing to see how can we contain it in a manner that it doesn't spread or the spread can be delayed so that we can buy time to really develop vaccines and newer drugs to control or understand a new outbreak or a novel infection which has happened. So I think we need to develop strategies. We need to have an action plan in place in terms of how do we upscale our healthcare facilities, which are already stretched in case of an increased surge in the number of cases. A lot has been done. We are in a better place. Now we have better let's say, oxygen available at all places, even smaller towns and
Yeah.
cities. There is now a plan of how to have drug deliveries being done. Vaccines have really picked up very well. There's a huge, now India is becoming a hub for vaccine research. And we've shown that we have the capacity for not only developing new vaccines, but delivering the vaccine to even remote parts of the country by a good mechanism. So that way we are prepared. But pandemic always means that you need to be better prepared than last time. And I think that is something that we need to do.
Yeah. You know, whenever I'm with anyone who is above 60, the one piece of advice they always give me is, beta, take care of your health. You know, you don't realize how important it is. You can have all the wealth, you can have all the friends, you can have all the followers, but when your health goes, you're actually left with very little in life. And then I have these conversations with doctors and I see how much is happening with healthcare. And, you know, I like to start my year on gratitude. So I'm so grateful that as a young person, I am in this modern era when there's so much happening with medicine, so many treatments, cancers that we never thought would get better. You know, it was a death sentence. Today, people can walk out and they're all okay with it. All these infectious diseases. There's so much to be thankful for. And thank you so much for sharing all that you have, sir. Thank you.
Thank you very much. Thank you for having me. And a very happy new year to everyone, to all your readers.
Thank you. Um, what would your thoughts be about modern medicine? And do you trust it or are you afraid of it? You can write to us at pods@indiatoday.com or on 8588 And if this episode has helped you in any way, please do rate us. We are available on Apple, Google, and Spotify. Thank you, sir. Thank you so much.
Thank you.